Well, Jody, that actual drop-off time doesn't begin until 10 this morning, but we asked the DEA to set up a little early for us because what we're dealing with is a critical public safety and public health issue. How serious, you might ask? Well, a recent survey shows some 2 million Americans abuse prescription drugs, and a majority of those prescription drugs come from family and friends straight out of the medicine cabinet at home. So today, the Drug Enforcement Administration and local and state law enforcement officials are teaming up for National Drug Take-Back Day, and it's being held across the country, across the state, and one of the sites is here at the state capitol. And with us this morning, we have Robin Dinlocker. She's the PIO for the DEA, and Keith Komita, he's Deputy Director for Law Enforcement with the Department of Public Safety. And good morning to both of you.
Good morning.
Now, how effective is this drug take-back program, really?
Extremely effective. As you said, due to this national trend of prescription drug abuse, a lot of people, they don't think about it. They don't know how to dispose of the drugs, so they keep them in their medicine cabinets. And that just leaves like a loaded gun in your house for somebody to go in, like a child just experimenting. They go into that and they take it. And if you take a drug that's not prescribed for you, it can have very serious consequences up until including death.
That's true. And I guess some other ways that people dispose of them is to flush them down the toilet, which is not a good thing either, right?
It's very bad because it goes into our water supply. We try and tell the public to either save them up and bring them to these take-back programs or to use the oil exchange boxes and throw it away that way.
Well, what kind of drugs are you accepting today?
We're accepting all controlled substances. Again, it's free and anonymous, so please come down between 10 and 2 and feel free to turn them in, no questions asked.
Okay, and again, you're going to be set up out here. People can just drive by, drop off the drugs.
We'll run out and pick it up from you, straight from your car. You don't have to get out. What we will do is protect your identity, so when it comes up to us, we will black out your name, so you don't have to take them out of the vials, and we'll destroy them that way.
Okay, people will be collecting and they will be destroyed.
Yes.
Okay.
Exactly. We'll dispose of everything once they come up. They just simply hand it to us. We'll put it into the boxes over here, seal up the boxes, and then we dispose of them.
Okay, and so there's going to be many sites around the state. Check the website.
Correct. There's going to be 8 sites on Oahu. There's going to be 2 sites on the Big Island. There's going to be 1 site on Maui and 1 site on Kauai. And if you go to DEA.gov, click on the icon that says Got Drugs, you can literally put in your zip code, and the closest location near you will pop up.
Okay. All right. Sounds great. Well, in the next hour, we're going to talk a little bit more about how can you tell if one of your loved ones is abusing prescription drugs. You're going to help explain some of that. That's coming up in the next hour. Back to you guys for now.